how are the ovaries evaluated, and how are the fallopian tubes evaluated, and how is the uterus evaluated?
That question means there are three components in a woman: the ovaries, the fallopian tubes, one on either side, and the uterus. Now, the uterus is where the baby lands or where the baby grows. Each one is evaluated differently. The modality which is common now and non invasive, non troublesome, is where you're looking to see if the organs are normal or not. Sonography has developed so much now. Sonography has reached that point of evolution where a lot of information can be drawn by good sonography. It tells us how the ovary is. It tells us how many eggs are likely to come up in a given cycle. It can unequivocally and accurately tell us when the egg grows properly and when it comes out, which means it is probably the most precise way in which we can tell when the woman has her most fertile phase. Simultaneously, sonography can give me the answer about how the uterus shape is. Is it divided into two? Does it have maybe an obstruction in between? Is there a polyp? And many such things. So, sonography gives me a lot of information about the uterus and the ovary. Unfortunately, sonography may not give us a straightforward answer about the status of the fallopian tubes. There is a procedure which can roughly tell me, it's a screening procedure, which we call as hysterosalpingography or HSG. A radio-opaque dye is pushed through the woman's uterus into the fallopian tube and a contrast X-ray is taken. This illuminates the fallopian tube and a course. Now, these are various tests that are recommended. Finally, the gold standard to evaluate the pelvic organs, as they are called, is by doing a laparohysteroscopy. Laparohysteroscopy means I put in a self-illuminated telescope under anesthesia through the woman's umbilicus to visualize the organs, to evaluate their capacity, to improve it if required, which is called operative laparoscopy. So all this gives us a very comprehensive and a good idea about the female's reproductive organs.
Doctor, now I will ask about men. What does a semen evaluation means, and what should be the male patient's attitude to the treatment?
It's a very valid question because a male often enough equates himself or his manliness with his semen count. We often have males who come in, look at a count, look at the normal parameters and start interpreting that as to whether he is a normal male or an abnormal one. It's unfortunate that you should never try to interpret a result like this. A semen analysis which is done has to be done with 4 days of abstinence. It has to be done in a proper laboratory setting by a qualified person. And whatever you see as a report is an extrapolation, not an exact value. Done in a correct hand, it will give me an idea whether we need to do something about the sperm. Now, in regard to the sperm, the required sperm to have a baby is just one sperm. And there are millions of them. So if typically a male walks into my clinic and says, I have a low semen count, it is really based not on his calculation. The parameters have started changing. I must assure the people who are listening to this that in a male's case, even if the count is very low, sometimes even if it is as low as 1 or 2 sperm that we have, we can give them a healthy baby out of it. In some cases, we may even get a 0 count, and there are some surviving sperm inside the testes. Now, again, science has progressed to a point where we can extract those sperm, get them out, and help them have their own biological child.
काय झालं?